So the first injury we have is the acromioclavicular sprain. That's also known as the AC joint sprain. That's an injury to the ligament that holds the acromioclavicular or AC joint together at the top of the shoulder. So the treatment methods I chose were electric stimulation, which is going to be 2 times a day for 7 minutes, and then low intensity ultrasound for 2 times a day for 7 minutes. And both of those will be the first couple weeks after the injury occurs. So the rehab exercises we have are the Codman's circumduction exercises. So you're going to get yourself a lightweight dumbbell just for some resistance. Slightly lean over, bracing yourself against the surface. And with your arms straight, you're just going to do small rotations at the shoulder. And so you're going to go both ways on that, each way for 10 reps, 10 to 15 reps for 2 sets, and that'll be every day after the initial treatment has occurred. The next rehab exercise we have will be sawing. So you're going to have your back straight, elbow at a 90-degree angle, same lightweight dumbbell for some resistance, and you're just going to go slightly back and forth. Back and forth, range of motion depending on the patient's pain and their pain tolerance. And that's going to go for 10 reps for about 3 sets. And that'll be once a day following the initial treatment. The final one we have is the active assisting wall climb. So you find yourself a wall, get one finger out, and you're just going to start at shoulder height and just run your finger up the wall as far as you can, fully extended, and then come slowly back down. And that will also be for 10 to 15 reps and shooting for 3 sets, and that'll be once a day. So the next injury we have is the inverted ankle sprain. That is when the ankle is plantar flexed and internally rotated, and the ligaments on the outside of the ankle are strained and possibly torn due to that sudden stretching. So the treatments for that is going to be a 7-minute ice massage. So you're going to get an ice pack or an ice ball or something of that sort and work it out for 7 minutes, and that'll be once a day starting on the 2nd or 3rd day after the injury. And then following that would be a cold whirlpool for 10 minutes once a day for the next couple weeks following that treatment. So the first rehab exercise that we have is going to be toe gripping. Toe gripping and also spreading. So you're going to flex the toes, squeeze them, and then open them. Squeeze them and open them. And that will be 10 to 15 reps every hour after the first day the injury has occurred. So that is going to be a high volume exercise. The next one we have is ankle circumduction. So you're just going to rotate the ankle slowly and controlled, and you want to do both ways, 10 to 15 reps, and that's going to be 3 sets. So another high volume, really working the ankle out, trying to get that mobility and flexibility back. And then the final one is going to continue to work on ankle flexibility, and you are just going to go flat foot and do 2 toe raises, so calf raises essentially. So you'll just go flat foot and raise your toes. Raise up on your toes, slow and controlled, really focusing on extending the ankle and stretching it out. So that's going to be 10 reps for 3 sets, and you would like to vary the foot position. So one set you want to point your toes outward, one set you want to point your toes inward, and one set you want to just have your toes neutral. Then the final injury we have is the finger sprain. That's when stretching or tearing of ligaments occur in the joints that support the fingers. So for this one, treatment is pretty simple. It's just essentially a jammed or stretched finger. So you want to keep it compressed with some kind of splint or wrap and ice it. So 20 minutes on, 20 minutes off, however long, just to keep the swelling down. And we have a couple rehab exercises For this one, you can use putty or a stress ball or anything like that. Here I just have a rolled up sock, which will work. You just need something to squeeze. So this is working on your hand grip function. So you just want to squeeze that, give it a good squeeze, and really work out the fingers and the thumb depending on what finger has been jammed. So that's going to be for 10 reps, right around 3 sets a day after the initial injury. Also, we'll have just a regular rubber band here, and you'll just stretch it out over the fingers and then just work the fingers for finger strengthening. So that's going to allow it to have some resistance and really work out any buildup or whatever swelling is in there and work on the range of motion of the finger. So that will be 10 reps, right around 3 sets, so pretty high volume. And then the final one is working on finger dexterity. So we just have some coins, and you're just going to work on picking the coin up and putting the coin back down. That is going to be pretty high volume at 10 reps for 5 sets, just working on the fine motor skills and getting the feeling and movement back in the finger that is affected and really honing in those skills again.